234 people died inside local Kentucky jails over the past 5 years. Of those deaths, 165, roughly 7 out of 10, had not been convicted of the crime for which they were being held. These are the findings of a 6-month-long investigation. I'm Taylor Six, the crime and courts reporter for the Lexington Herald-Leader, and here's what I found while reporting this story. Between 2008 and 2019, the most deaths recorded in a single year in Kentucky jails was 32. In 2021, that number jumped to 56, and it peaked at 63 in 2022. By 2024, it had fallen to 34. Corrections officials blame the fatal trend on a few factors, including COVID-19, the rise of high-potency drugs, and the general lifestyle dangers of many inmates, including unsanitary drug habits, pre-existing conditions, and transient conditions. But advocates and researchers say Kentucky has an urgent problem. It has one of the highest incarceration rates in the United States and worldwide, with nearly 1 in every 125 residents incarcerated at any given time. Experts say suicides, drug overdoses, and the catch-all term natural causes make up an alarming trend of a lack of continuity of care and medical training in Kentucky jails, and the death toll could be even higher if it was measured differently. Wanda Bertram, communications strategist with the Prison Policy Initiative, said the classification of natural jail deaths can be misleading. People booked into jails and prisons often have pre-existing health conditions, but if they continued to receive the care they received outside the jail, death would not be the end result. The jails that have reported the most deaths since 2020 are Jefferson, Madison, Fayette, and Christian counties. Whitley, Hardin, and Laurel County jails fell in the 5th spot for the highest rate of deaths among their population. According to autopsy records for deaths at those 7 jails, 40% were attributed to natural deaths, 31% were deemed accidental, 20% were rolled suicides, 1 homicide was recorded, and 1 manner of death was undetermined. However, local jailers I interviewed for this story argue that inmates receive better health care than what they would receive outside of the jails. Madison County Deputy Jailer Tom Jones said the realities of the lifestyle some inmates live are catching up with them, contributing to the higher rates of deaths over the past 5 years. Corrections officials believe the public has an opinion that they are dispassionate to those in their care, and that lawsuits can inaccurately depict the care that does take place inside their facility. In addition to the human cost, jail fatalities have a monetary cost to taxpayers. State-affiliated insurance companies have paid at least $5 million in jail death lawsuits since 2020. You can read the full story at Kentucky.com. Thanks for watching.